Joining me today is Dr. Noa Tal, a fellowship-trained endocrinologist dedicated to delivering exceptional patient-centered care at Pacific Neuroscience Institute, also known as PNI. She is part of a multidisciplinary Pituitary Disorder Center, collaborating closely with neurosurgery, neuro-oncology, radiation oncology, neuroradiology, and ophthalmology to provide comprehensive care to patients with pituitary and neuroendocrine conditions. Dr. Tal earned her medical degree from Tel Aviv University and completed her internal medicine residency at Montefiore Medical Center in New York, followed by an endocrinology fellowship at Cedar-Sinai Medical Center in Los Angeles. Her academic interests include pituitary pathology and long-term patient outcomes, with a particular focus on quality of life after treatment. Passionate about wellness and lifestyle medicine, Dr. Tal volunteered with Plant Powered Metro New York and has additional training in nutrition, lifestyle intervention, and yoga instruction. She integrates a holistic approach into her practice, aiming to advance patient care and contribute meaningful wellness in medicine. Dr. Tal, I am so forward to having you here and having this conversation. Welcome to Talking Acromegaly with Tony.
Thank you so much for having me. I am so excited to be here.
I am so looking forward to having this conversation with you. However, before we jump in, I'd like to say, as someone living with acromegaly, I've learned that managing this condition goes far beyond surgery and medication. Lifestyle, stress, nutrition, and mental well-being all play a role in how I feel day to day. That's why I'm really interested in your patient-centered care approach. So let me start here. What inspired you to integrate lifestyle medicine, things like nutrition, movement, and yoga into the way you care for patients with endocrine disorders?
So I think what really inspired me to have this a big part of my life are two things. The first one is my personal experience. Throughout the life, I was not diagnosed with a pituitary disorder, but throughout my adult life, from the age of 20, incorporating yoga, incorporate healthy diet, really helped me to navigate stressful events throughout my life. While Western medicine, this is how I train, and I appreciate it and I value it very much, and I think it is super important. We also need, for myself and for others, the component of holistic treatment to really balance out our life and find our center. And this is my personal experience that had inspired me, but also caring for patients with pituitary disorders many times after surgery, even when with or without medical treatment, even when the growth hormone level is normal, the IGF level is normal for patients with acromegaly, but also patients with Cushing and prolactinoma or non-functional pituitary tumors. When all the levels appear to be normal, many times we see patients still having symptoms like stress, weight changes, pain in their joints, mobility issues, sleep conditions, or sleep abnormalities. And with Western medicine, how important it is to take care of acute condition for the day-to-day life, incorporating nutrition, healthy nutrition, incorporate healthy movement, incorporate ways to make sure that we sleep well and we unwind and we manage our stress is as important as surgery and medical treatment.
I believe so. I suffer from joint pain. I have sleep apnea, so I can definitely relate. Also, many patients focus on medications and surgery. But what daily habits can make a big difference for someone like myself living with acromegaly from your approach?
So I think that should be very individualized depending on specific conditions and specific symptoms that a patient has. But overall, focusing on these 4 aspects or even 5 aspects: 1, nutrition, sleep, movement, stress management, and social engagement can really help. But how exactly, or what changes, and what specific exercise, and what specific diet, and what specific tips and recommendation are very, very individualized for each patient. I do try to understand exactly what, if you have joint pain or back pain, where is the pain? What exercise would be the best for a specific condition? If the symptoms are of indigestion, is it diarrhea? Is it constipation? Because they will navigate me to different recommendations based on specific foods that can be more beneficial here or there. So again, it's very, very specific, very, very individualized.
Understood. And thinking from an individual aspect, a lot of people, like myself, and I was one of them at one point, who suffer specifically with acromegaly, tend to move away from social engagement. And that's one of the ways that you take in treating it with your approach. So, one thing that makes your approach unique is integrating the lifestyle medicine into care. What does that specifically look like in your practice?
So I can give you like some, just from today, okay? If I had a patient coming to me and telling me I have constipation, I cannot, like, I haven't been in the bathroom for a couple of days. So I would say specifically for this condition, try to have ginger tea throughout the day. Try to have more cinnamon in your diet. In addition, for the social you mentioned, we have a monthly support group for all our patients with pituitary disorder, so we can really talk about common questions and concerns, and people can share and feel, and we can create a safe space for patients so they connect with other people that have similar concerns and similar difficulties. So this is on the social side of that. If I have patients coming with issues of sleep, then we also talk about what would be the best, like about sleep hygiene, making sure we have no screens 2 hours before the sleep, talking about breathing exercise to relax the sympathetic system and to activate the parasympathetic. So more specifically, I'm talking about inhale, let's say on a 3 of a count, and then exhale at 6 of a count. So to focus on the exhale, to lengthen the exhale, that really increases the parasympathetic system in our body and makes us relax before. And then, of course, having a couple of minutes of meditation and mindfulness before you go to sleep, and make sure to try to unwind and not to fight with your thoughts. If you have thinking, like, you don't need to sit in meditation and think, oh, I cannot think about anything, I have to be still, I have to empty my mind. No, this is not the case. Let the thoughts come by. It's okay. It's not wrong, but just try not to cling on them. If a thought is coming, then let it go away. Then another thought is coming, let it go away. I think a lot of the anxiety that we experience in life is because we dwell into thoughts and like go into our thinking too much. So just let the thought be there, and not engage with them as much as you can. And those exercises around bedtime, activating the parasympathetic system, making sure that the screens are out, like far away from our sleep, and meditating can really help relax. Other tips for sleeping would be to drink chamomile tea before bed. That also relaxes the nervous system, and to make sure not to eat at least 3 hours before bedtime, because that can also increase the digestion, and the body really needs to focus on resting.
So basically, staying out of your head, which is extremely hard for a lot of people, not only with acromegaly, pituitary disorders
Yeah,
in general, right? We tend to
because
overthink a little bit. Go right ahead, Dr. Tal.
so what I'm saying, yeah, you're absolutely right. So all this stress that many people have, right? Not just patients with pituitary disorders, but like patients with diabetes, patient with hypertension, patient without anything. Anxiety, depression, all affect our wellness, our stress unwinding, our sleep habits, weight even, because if we're stressed, we have cortisol levels. If someone is stressed, you'll have elevated cortisol, and it affects your testosterone level, your overall being. So let alone patients that already have hormonal abnormalities because of acromegaly, for instance, topping that with hormonal abnormalities due to not optimized lifestyle is significantly going to affect the quality of life.
You mentioned hormonal effect. When someone living with a hormonal condition like acromegaly, how does chronic stress affect the endocrine system in general?
So chronic stress increases cortisol, ACTH levels in the brain, increases cortisol level in the brain, increases catecholamine, adrenaline in the body. Like even think about yourself, I don't know, 20 years ago in high school, middle school, before a big test. Your entire body is burning. Your entire body is feeling that, whether if it's with palpitation, tremors, diarrhea. So our body is very sensitive to hormonal changes due to stress. So making a conscious attempt, a mindful attempt to wind down, to relax our body, to center ourselves is crucial to our quality of life for patients with pituitary disorder and for patients without.
Dr. Tal, you just mentioned you wanted me to think back 20 years ago. You're going to put me right back in my head. I was super sexy 20 years ago. And now with acromegaly, I'm just half the sexy guy that I was then. So I don't want to think about that too much, okay? However, how can nutrition, particularly the plant-based nutrition, support patients living with a hormonal disorder?
So plant-based nutrition is full with fibers, it's full with antioxidants, it is full with vitamins and minerals, which are all very supporting the body for overall health. Diabetes, hypertension, which are conditions that patients with acromegaly struggle with many times. It also reduces inflammation that can improve joint pain and bodily pain. And all the byproducts of the food that we eat also communicate with our brain, communicate with the hypothalamus, the center of body homeostasis, right? So short fatty acid that are breakdown from plant-based diet go to the hypothalamus. They go to the brain to communicate with the insulin secretion, with our appetite control, with our satiety, and in turn improve our habitus, reduce weight, increase insulin sensitivity in the body. Not just that, when you eat plant-based diet, and again, I'm not talking about nothing that I'm talking about, no diet, no nutrition, no sleep. It's not all or nothing. It's not 0 or 1. You can always do little steps. So when you have a lot of your diet is based on a plant-based diet, you also eat less of other unhealthy foods. And you always need to think about, what does your food come with, right? Like, does it have a lot of cholesterol in that? A lot of fat that increases insulin intolerance, right? So you are really trying to shift most of your diet, or the majority of your diet, to diet that is full with nutrients, anti-inflammatory properties, antioxidants that affect your entire body.
Let's dig a little bit deeper into that. What are some common misconceptions people have about plant-based diets?
I think one big one that even my husband always try to remind me is that the lack of protein in diet, right? So you think that if you are on a plant-based diet, then you don't get enough of protein. But I must say that I've never seen a gorilla or a bull that they don't have enough muscle mass. So this is one. But there is enough protein in a plant-based diet. You can easily go to 0.8 per kg or 1 per kg, depending on how much you exercise. Just personally speaking, from my own experience, let's say that among my friends, I probably have the most muscle mass, and I am, despite not eating meat at all or chicken. And I do get a nice amount of protein from quinoa, chickpeas, lentils, tofu, and you can easily get that.
Okay.
I think another thing is another misconception that you don't have enough energy. And really, I don't think that's the case. I think on the other end, you get a lot of energy. I feel very vibrant, and many people that I know. So I don't think that is also the case.
All right, I'll take that. Also, from your perspective, what are some lifestyle habits that can help people with acromegaly and pituitary disorders like myself feel better on a day-to-day basis?
So I think that the most important thing in those cases, is that it's a point of view, right? Is how you perceive yourself in this world and how you perceive the world in you as well. So a lot of that is is really mental work and thinking about exercises like mindfulness, meditation. If you want to think about, like, there are practical ways for the body to be healthier, if it's diet, yoga, movement, sleeping. But overall, how you feel is something in your mind. Our mind and our body are interconnected, right? What we feel in our body will present in our mind. What we feel in our mind will present in our body. And really trying to change the way that we perceive ourselves or others via meditation, mindfulness can have a huge impact on day-to-day life. And practicing, for me, it's yoga. Yoga is a great way to do that. And for several reasons. One, it increases your strength, which is important for metabolic health. Two, it increases your mobility and your flexibility, which is super important for patients with acromegaly because the effect the growth hormone and IGF-1 levels have on their joints and the bone. And three, it increases, unlike other types of sports like weight training and running and aerobic exercise, it actually increases the parasympathetic system in your body, where other sports increases the sympathetic, which is also important. I'm not saying not doing that. I think that aerobic exercise, weight training, specifically weight training, super important for health. Yoga has a way to combine multiple effect in a way that is calming the mind and the body.
Let's talk about diet a little bit. For someone with acromegaly who wants to improve their diet, where should they start? Where should we start without feeling overwhelmed? There are all these different diets and things of that nature, but where should we start, Dr. Tal?
Yes, I think the best way to start is not to cut out things from your diet, but just to add. So try to add more leafy green vegetables. Try to add more berries to your diet, more fruits, vegetables to increase really the load of vitamins and antioxidants in the body. I know I said start by adding, but also not eating processed food. You don't need to go whole plant-based nutrition in a second. You don't need to cut out all the meat that you have, all the eggs, all the dairy, all the chicken. But staying away from processed food is a key for health. So really, you can have a variety of foods, but really something that is more pure and natural in it. And this is how I would start. I would start with adding more fruits and vegetables and cutting processed foods.
Could you give me an example of something for breakfast?
So I think a great breakfast would be overnight oats. So you can just, before you go to sleep, you take a little jar, put oats in it, a spoon, like let's say half a cup of oats, a spoon of chia seeds. You can put a banana or mango. I use almond or soy milk or oat milk, but you can use any milk you want. Shake it, put it in the fridge overnight, wake up, eat it for breakfast. That's a great way to start the day. You can also put some almonds above that. This is one great breakfast. Another breakfast that you can do is take tofu and break it like 2 little pieces and fry it with some, not olive oil, because you want to have, when you fry, you want to have oil that burns in very high temperature. So like peanut oil or grape seed oil would be good options. Put some cumin, curcum, nutritional yeast for breakfast. That's also another great option.
Okay, that sounds great. I'm personally going to try or do exactly what you said. Right now, it's the springtime. I know you're in sunny Santa Monica. However, here in the Midwest, it's time for me to get ready for the summer. And
Okay.
starting with a better diet is the right place to start. That's why I was so excited to have you join me today. You also incorporate yoga, like you mentioned, into your practice. How can practices like yoga help people dealing with chronic diseases like acromegaly really help?
Yes. So mobility is the key here. Flexibility is the key. You want to make sure that you can move your hands, you can move your legs, you can move your head in a free fashion, right? Like one of the things that I always tell my patient and when I'm driving the car and my kids are behind me, I want to be able to do this and be able to continue driving without, looking back to them. And I want it to be not painful. And I want to have this mobility. So yoga increases the mobility, as we said, but also decreases inflammation in the body, also increases the parasympathetic, and that will help patients with acromegaly. Also, it centralizes you through the practice. You also do breathing exercise. You do something that is called ujjayi breathing, which is breathing through the back part of your throat, and that really relaxes and make you look inside, and you can really reflect on how you're feeling and what the body needs and what the mind needs. You can have tons of, while you're doing this physical exercise, but sometimes it's not very easy, you can have a lot of, insight of what's going on in your body, in your mind. I also want to mention about, sorry.
Go right ahead and mention what you wanted to mention.
Yeah, so I wanted to go back to diet. Another thing that can really help with diet is making sure that your meals are at least 4 hours apart. We usually graze throughout the day, and we don't really let our digestive system to rest. And after each meal, it's super important. It's very important to make sure that you digest all the food inside, wait 4 hours, and then eat. Sometimes after 2 hours, you feel like you're hungry, but it's not really hungry. It's the emptying of the stomach. So if you have a sip of water and wait 20 minutes, you'll see that the hunger has gone away, and you can wait to 2 more hours. So this is a very important point. Another very important point is do not eat fruits with your meal. Do not eat fruits after your meal, because then they're not gonna, usually fruit are digested very, very quickly. And when you eat it with other foods, they just linger in the stomach and are not being digested well. So always make sure to eat a fruit either half an hour before meal or 2 hours after the meal. Okay, so that's also very important.
That
point.
is very important. And that's also disappointing for me today because I thought I was eating healthy today, Dr. Tal. I had a veggie omelet, and afterwards I had some pineapples. So
Yeah.
and I thought I was doing better, but apparently you're telling me I'm not.
Well, for tomorrow, eat the pineapple, and then after that, you do a veggie omelet.
That will be the plan. Let me have you bag up a little bit. You mentioned
Yes.
ujjayi breathing. Can you explain a little bit about what that is? And I don't want to put you on the spot,
Yes.
but could you give us a little bit
Sure.
example?
Demonstration?
Demonstration.
Yeah.
That's the word I'm looking for.
Yeah. So ujjayi breathing is a breath that you do from your nose, and you do it for the back, from the posterior or the back part of your throat. It's like you're gonna do it with your mouth closed. Okay? So you're gonna go, I don't know if you can hear it.
I hear it.
And this is very prolonged breathing that you do through the exercise of when you do Ashtanga yoga, at least. And it's a type of pranayama. Pranayama is a breathing exercise. You have multiple types of breathing exercise in yoga, but this is one of them. And this is one that you do throughout the Ashtanga yoga practice. And it really, you can see when you practice, you want to keep it the same length, like inhale, exhale, 3, 4, 5 counts, depending on how you're comfortable with. Also breathing also only to the chest, to the lungs, and not through the abdomen. And you can see when you're practicing, if you're starting to breathe fast or your breath is in a rush or not smooth, then you know that you need to go back for a second and do it maybe a little bit slower. Okay, so the breath really reflects your state of mind and state of body throughout the practice. But even not during the practice, just sitting in meditation and breathing ujjayi breath is very beneficial for calming purposes and mindfulness.
And for how long would be recommended to do this?
Start with a minute or two. I would start with a minute or two and then go up to 5, 10 minutes.
Sounds good. I'll start there. From your perspective as a physician, what do you wish patients with pituitary disorders understood about their own power in managing their health?
Yes. So I think that what I want them to know is that they do have a lot to do with how they feel. As we talked, all these changes in their diet, in their exercise routine, in their sleep, in their stress management, in connection with other people, they can make it happen. And with that, to feel better with themselves and the surrounding. I'm not trying to minimize, because really having a pituitary disorder, and as I'm sure, like you said, it's not just changing how you're feeling, it's changing the comorbidities you need to manage, like joint pain, diabetes, hypertension. It changes how you appear, right? It changes your facial features, your head. So it is a lot to take in. It is a lot. However, incorporating all these changes in the lifestyle can empower a patient and let them know they can change their own life. They're not just like, I'm a acromegaly patient. No, I'm a person with a condition called acromegaly, but I also engage in ski. I also do this. I also do that. I also make a point. I meditate. So this is a condition they have, and they have power, and it's just a part of their life. It's not everything, and they have the power to modulate their life how they like it to be.
I get that, and I quite often say that, yes, I do have acromegaly, but acromegaly certainly doesn't have me. And I make sure
Exactly.
that I have conversations with other people who feel as though they are defeated by their acromegaly, and we in general shouldn't feel that way. And I'm hoping that I can get across to more people to where they don't. With that
I
said,
love it.
thank you. With that said, how can patients build a partnership with their endocrinologist rather than feeling like they're just being treated?
Ask questions. Ask questions. Okay, thank you for letting me know that the IGF-1 level is within goal, but what's next? What am I going to do next? So understand that you have the power to ask me for any guidance, to tell me, no, I don't think that's right. I don't think that's working for me. To understand this is a relationship, and often a very long-term relationship, right? So really feel comfortable to ask questions, and even tell me, no, you're wrong. That doesn't work. I need something else. And also, try to challenge your provider, saying, okay, what are you thinking? What are your recommendations? Not something that maybe the provider has suggested, but yeah.
Understood. Let me ask you this, doctor, and I typically ask my endocrinologist this. What made you choose endocrinology? Why did you practice and go in this direction?
So I did my undergrad in neuroscience, and I learned many things about the brain, but the lesson that really, or the course that really, captivated me was the neuroendocrine. And I learned about this tiny pituitary gland that does so much in the body. And I love the interplay, the complexity of it. This goes up, this goes down, this affects this. I like the mental challenge it has, but I also like the fact that you have to see the entire person. It's not like I'm treating your heart or your lungs or your foot. I am treating a person. And when you look at endocrinology, you have to look at almost every system in the body. And I like the holistic nature of it. So this is definitely two of the reasons I
Oh,
went into endocrine.
and we're happy to have you in the endocrine field. If you could change one thing about medicine and how pituitary disorders in patients are treated, what would that be?
Definitely adding the more holistic Eastern part of that. As I said, I have a lot of respect and I appreciate the Western medicine, and we wouldn't be here without that. But I feel like we have to have more of a comprehensive, holistic approach to a patient. It even starts, the problem with doing that, I wish in my 20, 30, 40 minutes with a patient, I could talk about everything, but it's not reimbursed. If I want to, let's say, start a yoga class for patients, no. It all has to be out of pocket. Nothing is reimbursed by insurance. So really have also not just the physician, the providers having more knowledge about that, which is a must, but also having the infrastructure to incorporate that to our practice. And this is one. A second thing is really to have a multidisciplinary team. I know here at PNI, we really have a 360-degree of providers around a patient, but to add on more. We are also fortunate to have just fabulous psychiatrists that if I do have patients that I see that the mental issues are a little bit more significant, I do refer to her, and we talk about that as well. But incorporating more of nutrition inside, physical therapy, yoga practice, mindfulness in the office settings. So I think that has to change.
Dr. Tal, you just mentioned you have a psychiatrist. So you have someone who's familiar with acromegaly and pituitary disorders? They're on staff? That is great to hear. I would love
Yeah.
to be able to have a conversation with her. Finding a therapist who's familiar with acromegaly in particular is very challenging. I didn't realize or know that you had someone there. I would be very interested in having a conversation with her. We'll have to talk about that later. With that said,
Okay, yeah. Yeah, she is also very special. So, and I think that we don't talk a lot of that, right? About the psychological or socio-psychological aspect of these diseases, like you said, since you or other patient and you included that have been diagnosed with acromegaly are becoming more isolated, and that affect the mental being, the psychological aspect of your life. Also, it's not just the hormonal changes or the physical changes, but having surgery done, having radiation, having medical treatment, they also take a toll on the brain.
you mentioned surgery, you mentioned medical treatment, and that's something that we as patients or people living with acromegaly worry about. What is something that your patients worry about that you believe they shouldn't, and what is something that you think they don't worry about enough?
That's a good question. I think that many times people are scared when they're hearing the words brain surgery. I am lucky to be in a facility with 2 or 3 amazing neurosurgeons that have a lot of experience, and they are very also reassuring when they speak with patients. So many times this concern is fading away quite quickly. I think that with the advance of technology, patients should know that this procedure is with the hands of a very experienced neurosurgeon, right? Not just going to any neurosurgeon. You need a neurosurgeon that had done hundreds and hundreds of cases of pituitary surgery. But in this case, when you are going to someone who has a lot of experience, the surgery is, at least in our facility, is 1 night in the hospital, usually no complication or transient effect of water and sodium imbalance, but mainly transient. So when you are with the hands of an experienced surgeon, you can rest assured that, we can't say 100% it is medicine, but more often or a lot more often than not, you should be fine. I think that another thing, I think that what patient should be concerned of, and maybe less, is that sometimes surgery is not enough. And you think that, oh, I'm going to go to surgery, they're going to take it out, I'll be cured. But no, it's not the case. Well, sometimes it is the case, but sometimes it is not. And the patient do need long-term follow-up, and sometimes the disease recur, and we need to talk about medical treatment or radiation treatment or another surgery. So really to understand, this is a very, very long process, and it's not one and done. It's a long-term relationship, as we mentioned.
That it is a long-term relationship. And luckily, I have a great endocrinologist like yourself that I have had a great long-term relationship with. Do you think the future of endocrinology will include more lifestyle-based care alongside with other traditional treatments, especially for chronic hormonal conditions?
I hope so. It must change. This is my vision, at least. This is what I want to do. I want to do a neuro recovery center for patients with pituitary disorders where they can come, they can be consulted on appropriate diet, about lifestyle modification, having their little society there, doing maybe something like yoga practice in a group. It has to,
And for you personally, how often do you do yoga?
as much as I can. Hopefully, like, it was usually between 4 to 6 times a week.
Oh, wow. The average person with
Yeah.
acromegaly probably couldn't pull that off. Just from a pain standpoint, I'm a
Well,
lot
it is.
better now, and actually, I feel the best that I've felt throughout my entire acromegaly journey. I feel great right now, and I'm thankful that I feel so good. Unfortunately, everyone doesn't, and we're all different. Before we wrap up, what message would you want someone living with acromegaly or another pituitary disorder to get from you today?
I want you to know that there are many ways in which you can improve your quality of life, like we just spoke about nutrition, lifestyle, diet, exercise, sleep, and social engagement. And that you're not alone. We're here with you to guide you through that. And, ask questions. We're just here.
And I've had a few endocrinologists that have joined me and don't want to put you on the spot. However, I'm curious, is there, from your perspective, do you bring something different to your treatment other than the holistic approach?
So, what I try to do, and I think even now with technology, it's a little bit easier when we can transcribe our appointment during that, is to listen to the patient. Instead of just being like that and typing everything that I hear, is that I'm able to look at the patient while they're talking and really to understand what is going on. I try to know the patients from their what do they do in their life, the comorbidities, their parents, their significant ones, their kids, to really understand the entire texture of the patient and also to hear what what is bothering you. So I think that for me, listening is in addition to the holistic aspect that I'm trying to incorporate as much as I can is to listen to the patient.
That is good to hear because there are so many people that I talk to who say they aren't heard by their doctors. And it's so reassuring to hear that you listen to your patients. I'm so thankful for you. This has been a truly amazing conversation. I want to thank you for your time, Dr. Tal. And more importantly, I want to thank you for talking acromegaly with Tony. It's been a pleasure having you today.
Thank you so much. It was my pleasure.
I look forward to possibly having another conversation with you in the future. And I'll close with this. This has been truly insightful conversation. I really appreciate the way you bring science, compassion, and a whole person approach to patient care. Hearing how you integrate lifestyle medicine, nutrition, movement, and mindfulness along with traditional endocrinology offers a powerful reminder that managing conditions like acromegaly isn't just about the numbers or the medication. It's about helping people live fuller, better lives. Your work at Pacific Neuroscience Institute and your dedication to improving the quality of life for people with pituitary disorders is great, and I am thankful for you. I know that people will take away a practical insight and a renewed sense of hope from this episode. And I also like to say, if this was meaningful and brought anything insightful to you, please like, comment, subscribe to the channel, follow me on all my social media platforms. Until next time, thanks for watching.